The following video contains mature subject matter. Viewer discretion is advised. The story you're about to hear is true. Only the names have been changed to protect the innocent. Keep it real.
Greetings, Internet people. You're tuned in to the Keep It Real RN channel. My name is Craig, and I'll be your host. Now, today we're going to do a feature called Story Time. And in this particular story, we have a physician, a cardiac surgeon, Dr. G. Now, Dr. G was really one of the nicest people you'd ever meet. In fact, he'd give you the shirt off his back. However, Dr. G did not deal with stress very well. And in this story, we have a patient who had had cardiac surgery somewhere at a typical hospital in the USA, and now it is the night shift. And this patient is not doing particularly well. In fact, this patient is doing very poorly and is experiencing a phenomenon called cardiac tamponade. Now, for those of you who are not familiar with cardiac tamponade in a post-op cardiac surgical patient is when the chest cavity fills up with blood, so much so to the point that the heart cannot fill. And this is an emergency situation that requires a cardiac surgeon to come in and immediately open the chest and relieve this pressure so that the heart can fill and we can restore a blood pressure and cardiac output. And then once you open the chest, you ultimately need to find the source of bleeding. But in order to save the patient, first and foremost, you need to open the chest and relieve the pressure. And now the patient is deteriorating right in front of our very eyes. So the nurse gets on the phone and calls Dr. G. Hello, Dr. G. I think your patient's tamponading. You need to come in. Now, on this particular night in the CVICU, the entire crew was relatively new. And what I mean by relatively new, we were all experienced from other places, but none of us had been working at this particular institution for more than a couple of years. And so we were not real versed in the routine of Dr. G when he had to re-enter a patient. So while we're waiting for Dr. G to come in, we're going around and getting things that we need and trying to get ready. Dr. G shows up relatively quickly before we were completely ready for him. Things are not progressing at the speed with which Dr. G would like. And he's yelling, "Get the volume, get some blood, get some suction, scrape the patient, come on, let's go." People are getting him these things, but again, like I said, it's not happening at the speed with which he would like. And you can see the longer it takes, the purpler his face is getting, and his vein in his neck is starting to stick out, and he starts yelling, "Hurry up! He's gonna fucking die! He's gonna fucking die!" So I'm standing there, I'm looking at this crazed lunatic now, and his ranting is not helping the situation. It's not helping people maintain the proper train of thought and helping them to work faster. We're getting the patient draped. We got the reentry cart there. We got some volume. Got somebody up on the pumps there. There's managing the drips. Now somebody has to step up to the bedside and help the man. And again, like I said, none of us are experienced at this facility in dealing with Dr. G when he's in this state. So I end up being Dr. G's helper. So now I got my sterile gown on, got my gloves, got my hat, got my mask, and I'm standing on the opposite side of the bed as Dr. G. So I open the reentry tray, and on the top layer, we have the scalpel. I hand him the scalpel. He cuts the skin on the chest. I hand him the wire cutters. He cuts the wires that are holding the sternum together. I hand him the big needle holders, which he uses to pull the wires out of the chest. Then I hand him the chest retractor, which he uses to spread the sternum apart. And after this, the pressure inside the chest has been relieved. The heart can fill with blood again, and we have blood pressure back. But we still have bleeding going on because the chest cavity is like a swimming pool full of blood. So I hand Dr. G the suction, and he suctions out the mediastinum. And he looks around for a bleeder, which for us, fortunately, he finds relatively quickly. So he looks up at me, and you got to realize, you know, his face is this far from my face. And this guy, like I said, he's a crazed lunatic by now. He looks like he's going to blow a gasket. His neck veins are bulging, his face is purple, and like I said, he looks like he's going to have a stroke or something. He says to me, "Give me the forceps." On any other day of the week, I could find the forceps in the tray, but in this particular instance, I'm now looking at the bottom layer of the tray that somebody has exposed, and inside this tray are hundreds, it looks like thousands of instruments in this tray, and I'm looking at them, and my mind is blank now. My mind is blank. And he goes, "I said, give me the forceps!" And I'm looking at the tray, and I can't act because, again, my mind is blank. I cannot identify the forceps in the tray. And he asked me a third time, and this time he's getting angrier. "Come on, give me the damn forceps!" Again, his face is like right here in my face now. I said to Dr. G, "What the hell's a forceps?" "It's the big fucking tweezers!" And he throws his hands up and he goes, "Oh my God, get Dr. Johnson on the phone." Now, Dr. Johnson is his partner. And so he's yelling, "Get Dr. Johnson on the phone." So the unit secretary is getting Dr. Johnson on the phone. Now, you got to picture this, okay? She pages him. He calls back relatively quickly. But the phone, this is like back in the days before we had cordless phones in the unit or anything like that. So the phone that Dr. G has to use to talk to Dr. Johnson is tethered to the secretary's desk. And the cord really is not that long. So she takes the phone. She's got Dr. Johnson on the phone. She's taking the cord and she stretches out from the desk as far as she can. And it's still a good 10 feet away from Dr. G, even with the cord stretched out to the max. So she goes, "I'm sorry, I can't bring it any further." And he's getting angrier and angrier. And now she's holding the phone out like this. And he's about 10 feet away from the phone. And he's yelling, "Bill, you gotta come in here. I'm here all by myself. I'm here all by myself." And we're like looking at this lunatic. And like I said, we're afraid he's gonna have a stroke because his neck veins are bulging. He's purple. He still looks like he's gonna blow a gasket. And we're thinking, here all by yourself. We got like 5 or 6 nurses here helping you out. You're not here by yourself. But anyway, so to make a long story short, he found the bleeder. I handed him the forceps that he wanted. He picked something up. We hand him the clip gun. He goes there, he clips the bleeder, and everything is good. We repack the chest, and we're cleaning up, and Dr. Johnson comes in. It seemed like forever, but it was probably like maybe 10 minutes tops. Dr. Johnson comes in, and Dr. G is like, "Bill, you should have seen me. I really did good." And Dr. Johnson says under his breath, "No, that's not the version that I heard." And when all was said and done, Dr. G apologized for his behavior. So please rate this video and leave a comment below. And if you like this video, share it with your friends. In fact, share it with your friends even if you think it sucks. Hit the subscribe button up there and join us as a passenger on the Keep It Real RN Express. So until next time, keep it real. The patient is due to... I think you got to come in. Your patient's tamponading. Damn it. Now, on this particularly night... You need to come in, your patient's tamponading. Sterile gloves, my gown, my mask, my hat, and I'm at on the opposite side of the bed as Dr. But obviously we still have bleeding because the mediastinum of the chest is full of blood like a friggin' And he says to me, "Give me the scalpel."